Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is June 19th, 2020. As always, we start with our COVID-19 statistics. Right now, worldwide, we have more than 8.7 million cases and over 461,000 deaths. In the United States, we have nearly 2.3 million cases and over 121,000 deaths. We'll start off today by revisiting a couple of topics that we've talked about previously on our weekly reports. The first one is hydroxychloroquine. It's in the news again because the World Health Organization has once again stopped trials to study the effectiveness of hydroxychloroquine against COVID-19. The reason why they stopped the trials is because their own trial and others from other organizations have shown, the preliminary results at least have shown that it does not help against COVID-19. That, in addition to concerns about increased side effects such as heart conditions and increased chance of death, all that combined went into their decision to just stop the trials outright. This week, the FDA also revoked its emergency authorization for use of hydroxychloroquine as a treatment for COVID-19. So this is absolutely a case where listening to the scientists who actually know what they're talking about makes a lot more sense than listening to the politicians or any other people who are just guessing. As we've said many times before on this program, please do not try to use hydroxychloroquine to treat COVID-19. It just doesn't work. There are side effects. You do not want to cause problems with your health because you're trying to use that drug. Another bit of news we've talked about a little bit in the past couple weeks is COVID-19 and blood types. Another study came out this week confirming the results that we'd seen from other studies that people with blood type O are able to resist the COVID-19. They have a lesser chance of getting COVID-19, and those with blood type A have a slightly higher chance of getting COVID-19. Now, like we mentioned last week, the difference is very small. It's statistically significant as far as the scientific side of things goes, but as far as what you'd normally see, in your daily life, it's not a big enough difference to be able to say, hey, I'm blood type O, I'm going to be safe, or I'm blood type A, I'm going to get it. It just isn't that big of a difference. Still, no matter what blood type you are, you still need to follow the recommendations that the CDC has put out. A new potential vaccine has started human trials this week. It uses a new process that may make it appropriate as a template for many other vaccines in the future, not just for COVID-19. Currently, there are over 100 potential COVID-19 vaccine trials happening throughout the world. Also, a new possible treatment for COVID-19 has been discovered this week. Dexamethasone, a steroid that's actually been around for a while and used for other things, has been found to decrease death for patients with COVID-19 who required a ventilator by 1/3, which is quite a huge amount. Also, it reduces deaths of COVID-19 patients who are not necessarily on a ventilator, but did require oxygen by 1/5. The results are still preliminary, but they are very promising. The study was done in Great Britain, and the scientists doing it, based off of their calculations, said that if they had known about dexamethasone early on, they could have saved 5,000 people in Great Britain alone, just based on the statistics and the calculations they're making. So this could be very good if further studies prove that it to actually work as they're seeing in the preliminary results. The CDC released more information this week about using hand sanitizers based on a new study that was done. The study showed that using an alcohol-based sanitizer for 30 seconds or more does inactivate the virus that causes COVID-19. Hand sanitizer needs to contain at least 60% ethanol or 70% isopropyl alcohol in order to be effective. The CDC also answered a question that many of us have had, which is, if hand sanitizers are so effective, why does the CDC keep telling us to wash our hands all the time? The CDC explained that hand washing, which includes scrubbing with soap for at least 20 seconds, is more effective at killing multiple types of germs. Hand sanitizer does kill COVID-19 and a number of other viruses and bacteria and other germs, but it does not kill all types of germs, parasites, other organisms that can cause us harm. Proper hand washing will also get rid of things that hand sanitizer does not, such as dirt, grease, pesticides, heavy metals, things like that. The current recommendation for those going out in public is to wear a face mask, avoid touching your face, stay at least 6 feet away from other people, wash hands when possible, and use hand sanitizer when washing your hands is not possible. Unfortunately, it looks like many people are not following the CDC guidelines. As many states start opening back up, COVID-19 cases have started to rise once again. Many states, including Florida and Texas, have experienced record high numbers of cases. Many of the hot spots, including in Florida and Idaho, are in bars and nightclubs. It's currently unclear why those spots are more likely to generate cases of COVID-19, but the speculation is that many of those who go to those types of places do not follow recommendations to begin with, and then after a few drinks, their inhibitions are even less. They become less likely to actually follow those recommendations even more than previously. It's important to realize that just because your state has reopened, it does not mean that there's no COVID-19 around at all and that COVID-19 is not an issue. We still need to follow the CDC recommendations no matter where you are. In addition to the cases seen in the United States, Beijing, China is also experiencing an outbreak of COVID-19. They have actually enacted a soft lockdown, similar to what we did here in the United States, maybe a little bit stricter than many of the places did in the United States, but it's still a soft lockdown, not as bad as what it was in Wuhan, China. But they've done that in hopes of eliminating the virus once and for all. In other news, outside of COVID-19, there is currently a recall for ground beef and ground beef patties that were made by MarketSide and Thomas Farms brands. This is due to possible E. coli contamination. All the beef that has been recalled has EST 46841 printed inside the USDA mark of inspection. In addition to that, you can look in the description of this video to find a link to the article that will give you more details, including case lot numbers and expiration dates, so you can check your ground beef or ground beef patties to verify if it is part of that recall. If it is, you can take it back to the store, get your money back, or just throw it away. Please do not eat it. E. coli is nasty. You do not want to get it. In Florida, officials are planning to release genetically modified mosquitoes in order to curb the mosquito population. All the modified mosquitoes are male, and any of the female mosquitoes who breed with the modified ones will produce offspring who die in the larval stage, so they'll never get to the point where they bite people or animals, and they will also never get to the point where they can reproduce. The hope is that the mosquito population will decrease dramatically over the next few years as the modified mosquitoes mingle with the current population. If the mosquito population drops dramatically, that should also drop the number of illnesses reported from mosquito-borne diseases. And that is all our report for this week. I'm Richard Greenland, and you have a happy Juneteenth.